When should you get a knee replacement? Hi, it's Dr. Ruth, the Pain Doc, founder of Chronic Pain Rescue. We are a telehealth practice, coaching practice, dedicated to helping those who suffer from chronic pain to live pain-free using holistic and integrated practices. That's a question that I've heard many times. Should I get a knee replacement? Should I do it now? Should I do it later? Just a rule of thumb. If you haven't had any kind of intervention, no therapy, if the only thing maybe you've done is medication, I definitely think you should try every avenue possible before you undergo surgery. And I know some people say, why should I do all that? The surgery will take care of it. And we see it as a kind of a quick fix. But understand, they have you sign an informed consent because there are risks with surgery, any surgery. One of them, there's a risk of getting urinary tract infections. There's a risk of bad reaction to the anesthesia. Anything may happen if you have pre-existing conditions like heart disease or high blood pressure, diabetes. There's risk of blood clots. But I think the real number one risk to fear, well, there's also the risk of it not healing well, not the wound not closing or the wound reopening. Those are risks. But the biggest one to me, because it can really prolong your recovery, is infection. Infection at the wound, infection at the prosthesis. If it gets infected, they have to remove it. And then they put an antibiotic spacer. And then you're on IV antibiotics for weeks and weeks. Well, we're really talking months to really clear out that infection. So all your recovery time is going to take that much longer. And when you have to have a revised knee replacement, it usually is just not as good as the first time. So that's why you put it off. It used to be in the past that the instrumentation for a knee replacement, they could guarantee it's going to last 10 years. Well, that's improved, and we know they can last 20 years. But even so, if you're getting the knee replacement at age 50, you got till 70, and if you're living beyond that, what's going to happen? There's not a guarantee that it lasts longer than the 20 years. So I recommend waiting. I recommend trying every avenue. Definitely do a course of physical therapy. If 3 months of physical therapy, you're not better, try injections. There are several types of injections. There's steroid injections, which take care of the inflammation and reduce the pain that way. There's hyaluronic acid injections. One of the brand names is Synvis. There's some others that's going to help to rebuild the cartilage and also put back that fluid cushion. There's normally a fluid, synovial fluid in the joint, which acts sort of like a shock absorber as padding. And with extensive osteoarthritis, that space becomes narrowed. Well, that hyaluronic acid is a thick liquid. It's going to help to put back that joint space. And usually people that get relief from this maybe have to get the injection every 6 months, but it helps. There's also PRP injections. That's where they remove some of your blood, they centrifuge it down, they get the stem cells, platelet stem cells, and they inject it. And those cells will grow up to become what you need in that area. If there's cartilage that's needed because maybe you don't have good lining of the surface anymore, there's no bone on bone as they call it. If you have some cartilage, the PRP injections can help to regrow that, help your arthritis. Remember, any intervention that you do, the idea is not just that, it's not going to work, why not have the surgery, but you might find that it actually does work. And say once therapy has stopped, you continue to practice the things that you learned to maintain the strength in that knee. Some people say, well, I can't do physical therapy. Try pool therapy. That's another option. Also, acupuncture, very effective with knee osteoarthritis. Now, I do have a friend who I felt was kind of young to have the surgery. However, I didn't know she had juvenile rheumatoid arthritis. So she's been living with pain a very long time. And it was time to do that. So I get that. But I do believe putting it off as long as you can, trying every avenue, definitely try holistic and integrative practices. We're here to help you. And if you feel you'd like to use a coach to help you through to getting better, I'm available. Please look at my social media posts. Go to www.chronicpainrescue.com and sign up for a free interview. I'm willing to do that and see if we'd be a good fit to work together. Until next time, peace and blessings.